So I've gotten this really great question a couple times. Let's get into it. Let's get out our trusty whiteboard again so we can see the relationship between the glandular tissue that produces milk and where implants go. So again, we're gonna have kind of neck, chest wall, breast, abdominal wall. Externally, of course, we have our nipple surrounded by our areola. And to the nipple is where all of our milk ducts are draining to. And I'm gonna put on screen an anatomic picture of what all of these breast lobules look like as they drain milk into these ducts to the nipple. So our implants can be placed sub-pec or behind the pectoralis muscle, or they can be subfascial, which is underneath the fascia but in front of the pectoralis muscle. But either of these implant locations for a breast augmentation are behind the breast tissue. This is very different when we're talking about a reconstruction for a breast with an implant, which can be a whole nother video. During a mastectomy, we're removing all the breast tissue, but regarding a breast augmentation, this would be the placement of an implant. That being said, the physical presence of an implant is behind where the milk is being made. So it just being there poses a very small, but not zero, risk to inhibiting the ability to breastfeed. What can be more important in this discussion is the incision placement. And so we're gonna switch to looking at the breast face on. Many patients who get breast augmentations are young, healthy, and don't yet have ptosis or drooping of the breast. These implants are often placed through an inframammary fold incision. So right underneath the breast, it'd be right along here. The plane is dissected and the implant is placed in one of these two locations from here. In patients that do not need a lift, there's an option for a transaxillary incision, and incisions made in the armpit, and the plane is dissected to put the implant where it goes. But those are only options if you're often young, have smaller breasts, and your nipple sits above your inframammary line. If you start to have ptosis or drooping of the breast, where the nipple starts to sit at or just below, or more severe ptosis where the nipple sits much below the inframammary line, then we need to talk about doing a lift, or else your implant's not gonna look good. You're gonna have things like a Snoopy Dog deformity. In order to do a lift with the augmentation, we're going to have to move the nipple. And in order to move the nipple, we have to make incisions around the nipple to do so. It generally means making this incision to preserve the areola and nipple, and making incisions to cut out a piece of skin to kind of cinch the breast together and lift that nipple up and place the breast tissue over top of the implant to give it back a more youthful appearance. And here is where we really start talking about the increased risk to structures required for breastfeeding. Talking about having to do a lift augmentation, our incisions are going to look more like this, like a lollipop and or anchor incision. When we're cutting around the nipple and areola, we're getting into where these ducts lie to drain milk to the nipple. And anytime we start making incisions where we may disrupt these ducts is when we're going to have an increased risk to breastfeeding. Additionally, some surgeons do offer a periareolar incision for a primary augmentation that doesn't even need a lift, and that can be for a desired scar outcome for patients, but it's something that definitely does increase that risk for breastfeeding, just given the scar placement. To summarize, having an augmentation done does not mean that you're not going to be able to breastfeed. In fact, having it through an axillary or an IMF incision, primary augmentation, is a low but not zero risk to a potential damage of structures to be able to breastfeed. However, incision placement is very important. Needing a breast lift can significantly increase the risk to damage the structures necessary for breastfeeding. And if you're interested, say so in the comments below and we can further discuss how and why certain incisions can increase your risk for altered nipple sensation, as well as other types of breast surgeries like breast reductions. The choice of breast reduction can also affect your risk for potential breastfeeding in the future. So let me know any of these topics or other plastic surgery topics you'd like me to talk about.